Welcome to this video on health statistics. Understanding data is crucial in public health, allowing us to measure and improve population well-being. Today we'll break down 4 key health measurement tools: mortality, morbidity, prevalence, and incidence, so you can confidently interpret real-world health data. Health statistics help us track diseases and assess the health of populations. They are used by policymakers, doctors, and researchers to make informed decisions about healthcare priorities. There are 4 key measures: mortality, which tracks deaths; morbidity, which measures illness; prevalence, which tells us how widespread a condition is; and incidence, which measures new cases over time. Let's explore each one in detail. First, we have mortality, which refers to the number of deaths in a population over a given period. Mortality rates are usually measured as deaths per 1,000 or 100,000 people per year. For example, mortality rates help us track the leading cause of death in Australia, such as heart disease, cancer, and respiratory conditions. Over time, mortality rates have changed due to medical advancements, disease prevention, and public health initiatives. This graph from the Australian Bureau of Statistics shows how mortality rates have declined from 7.5 per 1,000 people in 2000 to 6.2 in 2025. A decreasing mortality rate often signals improved healthcare systems and better living conditions. While mortality measures death rates, morbidity refers to illness and disease rates in a population. It helps us understand how many people are affected by specific health conditions and the overall burden of disease in a society. Common examples include diabetes, cardiovascular disease, respiratory conditions, and mental health disorders. This graph displays morbidity rates for common diseases in Australia. As you can see, mental health disorders affect nearly 20% of Australians annually, while heart disease and diabetes also have significant impacts on public health. Understanding morbidity helps healthcare providers allocate resources effectively and develop targeted interventions. Now let's look at prevalence. This refers to the total number of people living with a condition at a given time. It tells us how widespread a disease is in a population. For example, the prevalence of diabetes in Australia is around 7.5%, meaning nearly 1 in 13 Australians live with the condition. Prevalence and incidence are often confused, but they measure different things. Prevalence counts all existing cases of a disease, while incidence measures only the new cases that appear over a period of time. Think of it like a bucket of water. Prevalence is the full bucket representing all cases. Incidence is the new water being poured in, representing newly diagnosed cases. Why do these statistics matter? Health data helps governments, researchers, and healthcare professionals track disease patterns, allocate resources, and improve public health policies. For example, by analysing trends in diabetes or mental health conditions, governments can fund prevention programs and improve healthcare accessibility. Now that we understand key health statistics, let's explore how real-world data from the Australian Bureau of Statistics helps us analyse health trends and shape public health decisions. This graph illustrates the changing patterns of mortality in Australia from 1968 to 2017. Over time, we've seen significant declines in deaths from infectious diseases due to medical advancements, while lifestyle-related conditions such as heart disease and cancer remain leading causes of mortality. Next, let's look at the prevalence of chronic health conditions in Australia. This table highlights the percentage of Australians living with conditions such as diabetes, heart disease, and mental health disorders. Understanding these numbers allow healthcare providers to allocate resources effectively and implement targeted intervention programs. Mental health statistics from the ABS show that 1 in 5 Australians experience a mental health disorder each year, with higher prevalence among younger adults. This data informs mental health funding and policy decisions. To recap, health statistics help us track and understand public health trends. Mortality measures death rates, morbidity tracks illness rates. Prevalence looks at total existing cases. Incidence focuses on new cases over time. By analysing this data, we can improve healthcare planning, disease prevention, and overall public health outcomes. If you want to explore more, check out the Australian Bureau of Statistics website for up-to-date health reports. Thanks for watching.